Hi, hello, friends. My name is Max Casero. I'm the owner of Prism Integrated Health. Welcome to our health and wellness workshop on disordered eating here with one of our fantastic, super knowledgeable registered dietitians, Cindy Dallow, who is joining us from Colorado, where it is much colder, and an hour earlier. So thank you for making time for us today, Cindy. We're going to hop on in and get started. Just so everyone knows, we are recording. So Cindy, give us like a minute synopsis of who you are and your background as a registered dietitian, and then we will start with our slides and just start having this as a conversation. Sound good?
Sure. Hi there. I am Cindy Dallow. I've been a registered dietitian, I think since the mid 80s. So I've been doing nutrition counseling for a very long time. And even though I've worked in different areas of nutrition, disordered eating is something that kind of happens everywhere. So I've worked with clients from all walks of life, all different situations that have experienced disordered eating of some form or of another. I actually myself, back in my college days, definitely had some disordered eating. So I have a little personal experience as well. So,
Okay. So you made us some beautiful slides, and thank you for doing that. Oh my, did they go away? Hold on.
Sure.
I have to find them again. I'm so sorry. There
No
they
problem. Okay.
Okay. So we will open them. I promise I had them open. I don't know where they went.
Believe me, I can easily kind of talk about them, or I could probably bring them up too. I don't know if that helps.
My computer is doing all sorts of things right now. There we go. Do we have them?
I don't see them.
Let's see here. It's deciding whether it wants to download. That's where we are, because that would happen right now. Okay, so why don't we just go ahead though and start with what is disordered eating and what does it look like for you as a registered dietitian? So
Okay.
what are we looking for when we talk about disordered eating?
Sure. So disordered eating is, and I don't know if there is an official definition, but it's used to describe kind of a range of irregular eating behaviors. The thing that distinguishes disordered eating from an eating disorder is that disordered eating doesn't meet the diagnostic criteria set out by the American Psychiatric Association and the DSM-5. There is very specific criteria for various eating disorders that people have to meet to get that diagnosis. But disordered eating is a descriptive phrase. It's not a diagnosis. So, and I'm actually able to bring up my slides here.
Oh, I've got it. They just came up, so we're good.
Oh, yay. Let me pop back over there. I don't see them on my end.
I'm going to share my screen right now. So you
cool.
In just a second. We got them. There they are.
Yay.
Right.
Yeah. So I think that's the key thing to keep in mind is that disordered eating is not a diagnosis, but it's just eating patterns that are irregular, potentially harmful though, because, nobody eats perfectly. Nobody eats the 3 perfect meals every day. I don't, even as a dietitian, but disordered eating usually has some element of potential harm. And it's also I think the thoughts and feelings that go along with that can cause great harm. And disordered eating, in a lot of cases, not all, but in a lot of cases, end up developing into a full-blown eating disorder. So that's one of the reasons to be concerned.
Yeah.
Yeah.
Okay. And so here are some signs and symptoms. Let's go ahead and
Right.
review these because
Right.
that's about what I was going to ask you anyway. So
Yeah.
let's do it.
Yeah. So, I mean, one of the most common one is the frequent dieting and or manipulating food intake for the purposes of weight loss. That is the most common reason for disordered eating. And it's what I see all the time with men. And we'll talk a little bit about that a little bit later. It's not the manipulation of food intake is not for weight loss. It's actually for muscle gain. So, you know, it's maybe not too surprising. It's also some of the signs and symptoms would be if somebody's very anxious or upset or very concerned that they overate or they ate sugar or they ate some kind of food that they feel that they shouldn't eat. If you're wondering if somebody close to you has disordered eating, if you see that they lose and gain a lot of weight frequently, that can be a sign of it, but not always. Definitely the rigid rituals and routines surrounding food and exercise. When it becomes obsessive, you know, I mean, we all know exercise is good for us. We should be exercising. And to some degree, we want to watch what we eat because nutrition is important. But if we become obsessed with it and to the point where we can't seem to relax around food and or we're skipping meals or skipping family events that involve food because we're afraid to eat, that's when it gets into the disordered eating realm. Definitely preoccupation and over preoccupation with food, weight, and body image that negatively impacts quality of life. That's what I see in a lot of clients that I work with. Sometimes a feeling of loss of control around food, very compulsive eating habits sometimes. And then also using exercise, food restriction, fasting, or purging to make up for bad foods. So it's not, again, you know, because I'm a big believer in exercise. It's not exercising that's bad. It's if somebody says, and honestly, people say things like this all the time. Well, I just had that piece of cake, so now I got to walk an extra, 5 miles. You know, that's really that falls into the disordered eating, realm, especially. I mean, I guess let me I think in my mind at least clarify that a little bit more. It's disordered if that person cannot function unless they exercise to burn off those calories. I mean, I think it's one thing for a lot of us, like over the holidays, we're taking in extra calories. Yeah, it's not a bad idea to think, well, I probably should go for a walk because I've been, to me, that is kind of quote unquote normal. But if you're like, I can't function unless I go get that, I go burn off those calories. And or if you don't burn off those calories, you feel horrible about yourself.
Yeah.
So I think that's the difference there.
Yeah. From a mental health perspective, it seems like a lot of these behaviors, I mean, they have to do with control, right? And this false notion that we have the ability through our food intake to control what our bodies are doing.
Exactly.
Right? Whether we're gaining weight or losing weight.
Yes.
And so often disordered eating habits will start if someone is feeling anxious about something that's completely outside of the realm of food, but like they can control their food intake and they can monitor it. We've got all the apps and the things.
Yes.
And then suddenly it's about that need to control has shifted into the food. It's actually about something else.
Yes.
Right.
It is.
But then when they do it for such a long time, it becomes disordered eating, and then often it can move into eating disorder.
Right.
But I think it's interesting to note that it's often like it starts as a coping mechanism.
Yes.
For feeling out of control in some other part of your life.
Yes. Well, or feeling a wide range of emotions. And
sure,
I personally think that the root of emotional eating, well, there's kind of, I guess, two. And one is, I think for a lot of people, it's the fear of fat. There is a huge, intense fear of fatness. that drives the dieting and the preoccupation with food and eating. It's this intense fear of fat. And I think that is something that really needs to be unpacked by therapists and dietitians. I do some of that, but you know, it's awesome when I can work with a therapist, because there's, for a lot of people, some really deep seated feelings there. And then it's reinforced by, well-meaning health professionals, who are saying, well, if you lose weight, your blood sugar will be under control, or get your blood pressure under control. So there's that side of it. But the other piece, I think, from my experience and just my opinion, is that I think emotional eating also happens because we are afraid to feel the feelings, whatever those feelings are. And it relates to just exactly what you were saying. Maybe we have the fear of being out of control. Maybe we're anxious because we're going to college, or we're getting married, or we're, a ton of reasons to be anxious, right? Or depressed. We, a collective we in general, are, I think, afraid to feel and accept those feelings. And so I think a lot of the treatment involves helping people identify those feelings and sit with those feelings and experience those feelings, and to some degree accept. And we all know this is not easy stuff, right? I mean, who wants to feel depressed feelings and anxious and anger and all those feelings? But I've just, from what I've read, my own personal experience, I think it's just important for people to learn to accept those feelings, kind of more from observing them, and I'm sure you as a therapist have heard this, that to learn to sit with that feeling, kind of observe it, like, I wonder why I'm feeling so anxious. And for even identifying that it's anxiety. I think back in my early college days, I didn't even know what I was feeling. I had no idea. I just knew I was, I knew I was feeling something,
Right.
And I was just eating like crazy, to squash those feelings down. And so I think that happens a lot. And for me, fortunately, I had good people in my life that helped me kind of work through that. So, but what I also see in my practice, what is both men and women, is this intense fear of fat.
Yeah.
And so then it's like, what is that about? Right. So that's a whole other talk, probably.
We've got a lot of unlearning to do, and a lot of liberation work to do. And
it's normative. I mean, it's considered normal to be afraid of fat. Well, of course. Why would you want to be fat? Fat is wrong. Fat is this. Fat is that. Fat is unhealthy, and which is not always the case. That'll be the topic of another talk we're giving here. But yeah, I do. I think a lot of it is the fear of fat. Or being fat, gaining weight.
Yes, gaining weight. And what that means, because obviously our bodies are going to stay like they looked when we were 20, when we're 40 and 50, and our metabolism slow down, and our muscle mass is different, and our hormones change. And it's an unreasonable expectation.
And so we have this assumption, this very wrong assumption that you already brought up, that we can just control it. So, if you don't want to be fat, well, just go on a diet. That's all. That's all you have to do. It's so easy.
Super sustainable. It's gonna be great for you.
Right. Exactly. just stop eating those French fries. If you would just, I mean, I've actually heard people and read comments online where people would say, well, if they would just stop eating French fries, and and I'm just like, if it were that easy, So anyway.
So many factors, right?
Yes.
So let's talk about other specified feeding or eating disorders, because we know about anorexia and we know about bulimia, but there's a lot that happens. So take us through some of this information.
Well, and I just put this in here because there is a category in the DSM-5, and I'm not an expert on the DSM-5, so the therapists out there, including you, could probably speak more to this than me. It used to be called, they had another title, eating disorder not otherwise specified, and so
Yep.
now they've changed it to other specified feeding or eating disorders, which is kind of more or less the same concept, that just meaning that disordered eating falls outside of the criteria for eating disorders such as anorexia nervosa, bulimia nervosa, and so forth. So, and sometimes disordered eating is being bulimic, but they're not eating and purging as often as the criteria calls for. So either way, somebody who's bulimic and or restricting to the point where they're becoming, they're losing enough weight that it affects their health, it's harmful. It's very harmful, and they need help.
Yeah.
Right. So that's basically what this says here, is just that it's eating that falls outside of anorexia, bulimia, and well, actually binge eating disorder, I think, you can tell me on this. I think binge eating disorder, that's not a eating. It didn't used to be considered an eating disorder. It fell in the.
It fell in the bulimia range. So this is right. It used to fall in the
So
bulimia
I'm
range.
not sure where binge eating disorder falls right now.
Well,
yeah, I'm not sure about that.
I mean, I think that it probably would be similar to bulimia without the purging, right? Like the thing that makes bulimia.
Oh, right. I know what it is. I'm just not
Yeah.
sure if it's classified as an eating disorder or not. Yeah,
Oh, that's a good question.
Yeah, binge eating disorder is very similar to bulimia, except there's no purging. So both of them involve eating large amounts of food, larger than what's considered quote unquote normal, on a regular basis, and having the feeling that you can't stop. So it's not Thanksgiving dinner where you're sitting down and the food is so good and you're just going to let yourself have more than, or you just eat more than you normally would. It's eating with that feeling of, I can't stop, and just kind of stuffing, more or less. And then with binge eating disorder, there's no throwing up, self-purging, and or crazy exercise to burn those calories off. It's very common. I mean, I don't know the numbers of binge eating disorder, but I know in my own practice, I sure see more people with that than I see. And I very rarely see anybody with anorexia, because even though it's the most serious one, it's, I think, the least prevalent. So. Yeah,
I think that just anecdotally, that is something, anorexia is something that I see more frequently with Prism specializes in working with LGBT folks, right? And so where I see anorexia, it's sort of a specific base is for female-bodied people who are restricting calories as a means of preventing body fat, so they look more masculine.
Right, exactly.
And so they're restricting calories so they don't get hit, or so in the perception that they won't have breasts or what have you.
Right.
So I think that that's part of where what we do overlaps, right? Is really interesting and sort of niche places where disordered eating, or sometimes eating disorders, shows up because you're transgender or non-binary, and it's a means of controlling what your body looks like for gender-related reasons.
Yes, definitely. Definitely.
Or even with folks who are dealing with ADHD and need a lot of external stimulation. And so some people get that from food, which is where we would see a lot of binge eating disorder, right?
Right.
But in both of those cases, there's also this overlapping, sometimes, right? This is not a blanket statement, but sometimes there's this overlapping experience of being dissociated. So you're not even in your body to experience food,
Yeah.
And so I know that, intuitive eating and health at every size, a lot of that is about mindful eating.
Mm-hmm.
And we've talked about that previously, and we will talk about it again in the future. But thinking about like, we see sort of we. And a slide down or two, I saw the picture of Gwyneth Paltrow, and I was like, oh, we're going here. But right, like,
oh yeah,
we sort of when I think about like the poster child for how at least white cisgender heterosexual people think about disordered eating, it is absolutely Gwyneth Paltrow.
It is. It is.
But there are so many other populations who experience this for really validating, like for really valid reasons. Like it's an interesting thing that this experience is one that crosses all life spaces,
all lifespans.
Yeah,
it really does. It really does. Yep.
So let's talk about. Well, I guess in your experience, are there certain things, or like what? Here's the question: what would lead someone to a more like dealing more with anorexia versus bulimia versus binge eating? Have you noticed any like patterns or life experiences? Like what sort of impacts the way that someone's disordered eating might manifest?
That's a very good question. I have not worked with very many people with anorexia at all. So that is not an area of my expertise. I have worked with dietitians who have worked with that. And my husband, being a physician, has had some patients with anorexia nervosa. So, but I would definitely not be one to, I guess, say a lot about that. Bulimia, the people, I have worked with quite a few people with bulimia, and they've been college students mostly. Can't think of anybody older than college age that I personally have worked with. I have read that eating disorders the prevalence has grown in middle-aged women, women more my age. I have not so far worked with anybody in middle age, but anyway, I guess I would see from my experience, has been people who are dealing with some intense emotions, usually anxiety, and fear of fat and fear of losing control. I think it is people have to be careful with the thought that people with eating disorders have been sexually abused. From what I've, and I'm sure maybe more about this being a therapist, but I think that's sometimes a common thought that people think, and that's definitely, it happens, but it's not, it in no way, shape, or form is like a prerequisite to an eating disorder. Because I've worked with quite a few people with eating disorders that were not sexually abused. So I think that needs to be kind of separated. But again, it's just the people I've seen, they just have this intense fear of gaining weight. They just don't want to gain weight for all kinds of reasons. It could be, their doctor, their coach. A lot of times a coach has told them that. But like you said, I think sometimes in the LGBTQ community, sometimes there's like you said, a fear of developing breasts, for some people who don't want that. Or it's kind of a sign of maturing and becoming a sexual person, and they have a fear of that for whatever reason. So there's all kinds of reasons for people who develop an eating disorder. But I do think on the surface, at least, there is that fear of fatness.
Sure. Yeah. I'm just curious, because you and I have talked sort of on and off in various conversations about intermittent fasting being like the new fad.
The new fad, yes.
And in your experience, it would seem to me, just as a person who is observing things on the outside, that like intermittent fasting would have a high correlation with binge eating disorder. right?
You-
Like if you're,
I would think so. I don't know if there's any studies on that.
okay,
Yeah.
okay. Just curious if you have noticed. We will roll on down as we talk about various identities impacted by disordered
Sure.
eating.
Sure.
Disordered eating in men.
Yeah. So
yeah.
this from what I have read, is the fastest growing segment of people with eating disorders. And as it says there in the 1990s, 1 in 10 eating disordered cases were men, and now it's 1 in 4. And that's just people who present, for help with, who knows what it really is out in the real world. So I mean, when you look at the number of people with eating disorders, I'm pretty sure women still outnumber men. Of course, according to that's what that would say. But the segment of men with eating disorders and or disordered eating is growing rapidly. So, as we all know, there's some men have said they haven't sought help because they thought it was a woman's problem, right? And they didn't like the stigma. And some of the men that I have worked with, they don't necessarily think they have a problem, and not necessarily work with it, but some men that I know who have very disordered eating, they don't see it as a problem. So
how as a dietitian, because what the word that we use for that in therapy is denial.
Yeah, exactly.
Right.
Not just a river in Egypt, right?
Yeah. So like when you have a client, like a man, for instance, who comes in and doesn't think that they have disordered eating, but you are like, oh no, friends, this is a thing, this is real. How do you work with that resistance and denial?
That's an excellent question, because it's hard. And I'll never forget the young male cyclist that I worked with years ago. I worked for the Boulder Center for Sports Medicine in Boulder, Colorado. And one of my very first clients there was a cyclist who was on a cycling team. And in the cycling world, you don't want to weigh too much because there's this power to weight ratio. And the leaner you are, the faster you can go. So in the cycling world, in triathlon and running world, more endurance sports, men who have disordered eating are focused on weight. Versus, I just want to point out, the weightlifting, bodybuilding type of male who's doing more of those kinds of sports, their disordered eating is more about worrying about being too small. And can you stop, please? Oh, I'm sorry. Okay, sorry. Anyway, the cyclist that I worked with in Boulder, he was obsessed with his weight. And it wasn't so much aesthetic, although it might have been, but he just wanted to be on this team and he wanted to be fast. And so he had very, very clear disordered eating. I'll never forget, because he was eating a power bar, and this was in the mid 90s, before a lot of these sports nutrition products were out. And so he was eating power bars for his meals. And he came to me to help him lose more body fat. So he just didn't see it as, So it was interesting. So what do you do in that
What
situation? Do you do? It's hard. Well, what I did with him, from what I remember, is we focused on energy. Are you going to have the energy to go up those hills if that's all you're eating? You have to eat to have the energy that you need to do that. Right. You also need the carbohydrates for glycogen. So I came at it more from a sports performance perspective, because I knew that's all he was going to hear. I don't know if you're familiar with stages of change, but the pre-contemplation and all that, he was clearly in pre-contemplation. And for those of you who don't know what that means, that just means you're in that stage where you don't see the need to change. It's like, I'm fine. I just need to lose more weight.
Mhm.
So I knew that it probably wouldn't go anywhere if I said, well, you have an eating disorder,
Yeah.
But anyway, I've worked with and have known various runners and triathletes
Mhm.
over the years who clearly, in my mind, have disordered eating because they want to be faster.
Mhm.
And so that does mean getting leaner. And well, I'm not convinced that that's the only way to be faster, but in their mind,
Sure.
So anyway, so for what that's worth, but
Okay. And you do, I mean, you work with a lot of athletes, and so I'm curious because, we've got really interesting conversations around health and the use of like supplements.
mhm.
And so when we're talking about disordered eating or eating disorders, where do supplements fall into all of that?
That's a very good question. And it kind of depends on what kind of supplements
Sure.
that you're referring to. But I think if they're not eating enough, sometimes a supplement can help in terms of helping them to get the nutrition or the vitamins and minerals they need, but they're not going to get the energy, the carbohydrates, the protein,
Right.
from a vitamin supplement for sure.
Mhm.
And there's so many myths around supplements out there. Like some of the college students I've worked with before, and even some of the athletes I've talked with, they think that they can get energy from, a vitamin supplement, and that's just not true.
Mhm.
So I personally don't think supplements. I mean, dietitians, we're all about food, eating real food. So I
Right.
prefer to see people eating real food, but in certain situations, if they're not able to or unwilling to, then definitely sometimes, protein drinks and or some type of nutritional drink can help supplement what they need for nutrition.
Mhm.
Yeah.
Mhm. Okay.
Yeah, definitely.
Um,
So
muscle. Yeah.
yeah,
Go for it.
the muscle dysmorphia is a term now that's being used, and this is one of the predominant things that happen in men with eating disorders or disordered eating. And I just put this on here. It's defined by preoccupation with one's body being too small or inadequately muscular. And then
Mhm.
that results in some distress, functional impairment, and some maladaptive behaviors. So it all comes down to how the person is handling this desire to be bigger. I mean, I don't see anything wrong with somebody wanting to build some muscle, go to the
Mhm.
gym, lift some weights. That can be very positive. It can be very empowering. It can be, I mean, I just finished a book reading a book about a woman who weightlifts because it has actually helped her body image and her
Yeah.
psychological well-being.
Mhm.
I mean, I lift weights too, but
Mhm.
again, it comes back to the reasons why you're doing it, how you feel if you missed a workout, and
Right.
or again, how it affects your eating. So, it's a continuum, I think, and where people fall on that continuum.
Mhm.
Yeah.
And the through line here, right, and part of what we've talked about previously, and I think our next slide sort of gets to that too. Oh yes, is shame. The through line here is shame because
Okay.
we have these cultural norms that
Yes.
literally shame us into these behaviors.
Yes. Oh my gosh.
Um,
I
with the
just
world's most famous almond mom on this slide. Um,
when just recently, I did you, I'm sure you probably heard it. There was this big article about Gwyneth Paltrow. I think she posted on Instagram what she eats in a day. And
yeah,
I tried to find the original, was it an article or an Instagram post? I'm not
it was
sure.
like a podcast, I think, and they had
Okay.
a video of it because she was talking about how like she doesn't eat anything until 11 or noon, and then when she
And
does,
it's
it's usually bone broth or
bone broth.
you
Yeah.
know.
No,
Um,
I did read that she countered that a little bit later by saying, I don't do that every day. Some days I have meals or whatever. But boy, did the media pick up on that. And unfortunately, that's what a lot of susceptible people to eating disorders hear.
Right.
And, you know, I think Gwyneth and other famous people like that, they try to kind of present this way of eating as healthy. Like, I'm doing this for my health. And I kind of reading what Gwyneth Paltrow said. I mean, obviously I don't know her, but reading her statements and comments, I think she's convinced herself that she, you know, this is healthy. This is what makes my skin look so good. And aside from her skincare products, and you know, and so that makes it even harder, I think, to convince particularly young women who look up to her, that what she's doing is not healthy, because they're like, well, look at her. She looks fantastic. And it's all for her health. You know, she detoxes and she cleanses, and it's cleansing the body, and it's getting rid of all the, you know, supposed toxins that we have. And it's so easy to believe that.
Sure. But the underlying like trend here is, one, shame, and B, fear of being fat, right? Like fat phobia. I really
believe that's driving all of this in Gwyneth's case, even though she says it's for her health. I personally think she just doesn't want to be fat. And all the young women, and I would guess it's mostly young women that follow her, maybe young men do too, I don't know, but they kind of like, oh yeah, I want to be healthy, so I better just skip my breakfast and have bone broth for lunch as well, you know. And then it's kind of hard to untangle that from you know, the health focus from that the way they're eating is just unhealthy. They're not getting the nutrition that they need. And then it falls into disordered eating, and then definitely for some is going to lead to an eating disorder.
Sure.
Yeah.
And so this is a great segue. What are some of the health impacts of disordered eating?
Disordered eating. Well, you know, and obviously it depends on how extreme a person gets, but one of the biggest ones is just not getting the nutrients that you need, you know. I mean, not getting the protein that you need, not getting iron for, you know, young women that need iron. That's a big one. Iron deficiency anemia is, you know, young women are at risk for that. But even for other people, it's just not getting all the nutrients that you need. And I suppose some people could argue they'll take a vitamin or mineral supplement, like you said, but that's not going to give them all of the nutrients that they need. So and then what's the result of that? It depends on which nutrient that they're missing, but there's all kinds of, you know, health problems that can result. I think one of the biggest ones is when people are, and this happens a lot in women, they're not eating enough protein. And they if they're in middle age or over 40, then they risk, we have what's called sarcopenia, which is age-related muscle loss. Well, if you combine, which is a normal process, that's going to happen. But one way to reduce the amount of weight loss, or muscle loss, I should say, muscle loss, is by making sure you're getting enough protein and also strength training. But if they're skipping breakfast and eating bone broth, and that's another thing, but bone broth is very low in protein. People think it's high in protein. It's very low. It's a low quality protein, I should say. So anyway, so they risk muscle loss, and that can create a lot of problems. That can actually lead to some injuries, and you know, if they're not getting calcium and vitamin D, that can lead to stress fractures, and that happens. That can lead to osteoporosis. So it's, you know, it can affect a person's health, especially if it's long-term, where they're just not meeting their nutritional needs. The other thing is, like, I just don't think people are going to feel that great. And if they're not feeling good and they're not getting enough good quality carbohydrates, then they may not be exercising, because sometimes people do all this disordered eating thinking that they're healthy and not exercising. And in my mind, that's the worst thing you can do for your health, is to not exercise.
Backwards.
And yeah. So if they don't have the energy to exercise, that, to me, that's really bad for your health. So,
Sure.
yeah.
Okay.
But obviously it does depend on the degree to which they're doing this and the frequency which they're doing this. Yeah.
Yeah. How would you recommend sifting through the misinformation that exists around nutrition? What is good for you? What is not? What does our body need? Because there's like, you know, when I was growing up, we had the food pyramid, and that was sort of like just a widely accepted thing. And but now, and also, like, I know that also wasn't like the healthiest thing, but it was like we had a reference point. Like,
oh yeah, no, I think it was okay.
You know, it was okay, sure,
but we need
absolutely
more.
Yeah, it needed more. But now we have so much information and so much technology, and people doing weight loss shots and all of the supplements and the protein drinks, and like, how do we sift through all of that information to know what's actually like, what is healthy and what is good for our bodies?
Yeah. Well, I have pretty strong feelings about that. Being a dietitian, I think people should talk to a dietitian.
Yeah,
a registered dietitian. I mean, this is what we do for a living. This is what we study. We have to be a registered dietitian. You have to get a degree in nutrition and do an internship and then take an exam and then maintain professional, education. So this is our job. And, you've probably seen something similar, but it's the statement, don't confuse your Google search with my dietetics degree. And not to say that dietitians, that we know everything, I mean, nutrition is an evolving science, and it is, I know, even for myself, it's hard to keep up with all the different topics. And so I'm not at all saying that dietitians know everything about nutrition, but I would argue that we know more than most people. And I think the profession of a dietitian has kind of gotten a bad name, and there's maybe not a bad name, but there's kind of that stereotype that we wear hairnets and, we put food on hospital trays or whatever, but it's not the case. And so I would definitely encourage anybody out there that is confused to look for a dietitian in your area. You can go to the website, the Academy of Nutrition and Dietetics. They have a listing of dietitians all over the country, so you can find one that's close to you, because we're all over the place. And I would say most of us work online now, so it doesn't even have to be one that's nearby. So, and yeah.
So we have a question that came in through the chat.
Okay.
And this is about the relationship between disordered eating and autism, because a lot of kiddos who have autism have like texture related issues, or may not be able to even identify hunger cues. Right?
Because of the medications, right? Yep.
So how would you recommend supporting autistic children and teens in terms of adequate intake, especially around like specific food aversion?
Oh, that's an excellent question. I have not worked with autistic children, so that is not my area of expertise, but there are lots of dietitians that do. So I could find some if they wanted to. But I think that's an excellent question, because the texture issue is a big deal. I guess I think, and this is what a dietitian can do, is help that child meet their nutritional needs with foods that child would accept. So like if they don't like lettuce for whatever reason, well, you don't have to eat lettuce. You can get all the same nutrients in other foods. So I think that's really where a dietitian would really help, because we know food and we know nutrients, and we can put together meal plans and diets without, not weight loss diets, but a meal plan to help the child or adult get the nutrition that they need. Because I know, like, there's a lot of myths out there about certain foods, like bananas are high in potassium. Well, actually, baked potatoes have more potassium than a banana. So, and that's just something that average person might not know. Like, so I think a dietitian could just help them get their nutrition needs met without, without that child or adult, if it's an adult with autism, having to eat the food that they don't like because of the texture or the taste or the whatever it is. The medication issue, that's a tough one. The medications that reduce appetite, that is a tough one. I think, and you and I have talked about this. I think it's, coming up with a schedule, and having some cues for eating, trying to make the eating experience as pleasant as possible. One thing I work with parents on is, sit down and eat. Don't you yourself be grabbing something out of the refrigerator on your way out the door. Sit down and eat, talk to the child, make eating a pleasant, enjoyable experience where they look forward to that. And that can help. If they're on medication that reduces their appetite, at least that can maybe help. So
sure.
And there's other things like that you can do.
Yeah. So what I hear you saying is like finding replacement foods, right?
Definitely. Oh yeah. And exactly. So that person is, that's one thing I actually do fairly often with some of the people that I work with that are trying to meet their like protein and carbohydrate needs. And, sometimes people think that they can only get protein from meat. It's like, no, there's a lot of other places. So that's kind of, I think our expertise is crafting a meal plan, So, yeah. I
think, another thing, speaking of autism, right? Like some folks who have autism spectrum disorder can get hyperfixated on things, right?
Oh, yes.
So it might be really easy for someone who has autism to hyperfixate on a calorie count or on nutrition stuff. And so like, how do we balance that, right? So it's not so much as I have to eat 1,800 calories a day, and it has to be like there's a lot of sometimes flexibility issues there.
Yes, definitely. Flexibility is huge.
And so how would you encourage someone who has some challenges around flexibility, right, with
calories,
or like maybe you're out and you can only eat a cheeseburger and it's going to be X number of calories. And so, like that shame spiral and
yes,
and all of that, but it's like a developmental thing as opposed to like a fat phobic thing.
Yes. Yeah, exactly. Well, I think one thing that I would do is, my first thought was helping them to tune in to how are you feeling? If they can see that they can eat a cheeseburger and feel just fine, that can help, maybe even go have a cheeseburger with them if that's, and sit down and eat that and say, you feel okay? How do you feel? And they're probably gonna be like, fine. And so maybe they can learn that it's okay. It is okay to have a cheeseburger. It's okay to have junk food. But they have to learn that they can have it and life goes on. Right. And that it is part of normal eating is flexibility and being flexible. So I think with somebody with that kind of I don't know if it would be autistic or what, but it's just kind of over and repeated experiences of learning that it's okay to be flexible. I know I've worked with people who are very rigid and I have to eat at 8, I have to eat at 12, and I have to eat at 5. And so when they weren't able to because of travel or whatever, then I had them stop and think, well, how did you feel when you had to have lunch at 10 a.m. instead of 12? Right. Felt okay. So it's just kind of that kind of thing. I'd have to think about that too. What else? I think also just reminding them, and this is something that I tell a lot of people, and they seem to be kind of surprised, is that normal eating and or healthy eating does not look the same every day. Sure. we have to be flexible. We have to be flexible about the food we eat, where we eat it, what time we eat it. That doesn't mean to be just so random all the time. I do think there's actually some good to having a structure, but to have flexibility within that structure, you know, because life happens, right? And it's always going to happen. So I guess it's tough, but the more you can help somebody see that flexibility is good and that it's okay to eat differently one day than you ate the next day, or you ate the previous day, then that may help. So
that's a lot of what we do with like generally like a cognitive behavioral approach, and what we do with anxiety management is a lot of what we call graduated exposure therapy.
Okay.
Basically, right?
Yes.
Where it's just
Yes.
like testing something new, sitting in the discomfort of testing new, and then learning that it's safe and okay, but doing it just like incrementally, a little bit at a time, or a little shift, or a little change.
Little
right?
shifts.
Not so rigid.
Not so rigid, and seeing that you can do just fine.
Yeah.
Right. Or that, you know, you may, just learning that's just how life is. We have to kind of go with the flow to a certain extent. And that's just the way that it is, the way we have to all of us have to get by. So, and then hopefully that with, you know, some good therapy like what you're doing.
So I want to, hold on, do we have another, I want to make sure I didn't miss any questions. Nope, that's it. So last and final question, and this is sort of a plug for your intuitive eating section in June, is how does intuitive eating or health at every size approach disordered eating?
What was the last part?
How does intuitive eating or health at every size approach disordered eating?
Oh, disordered eating. I'm sorry. I think it affects it a lot.
Okay.
Because once I think that the concept of health at every size, and we can't get into that right now.
Sure.
Will in some people, or I think most people, will help alleviate the fear of fat. It might not completely change it or completely take it away. In fact, I doubt if it would completely take it away, but it will definitely alter it enough that at least what I find, because I use health at every size concepts in all my counseling. And people, in my experience, seem more relaxed or like kind of relieved to know, okay, you mean I don't have to weigh 120 pounds to be healthy? No, not at all. You know, there's a lot of stuff that goes along with that. And there's actually a grieving process sometimes of letting go of that dream of that thin body. And that's a whole other talk. But once you get to that belief, or at least start to understand that healthy bodies come in a whole range of sizes and shapes, it can sometimes help alleviate the disordered eating, because, and I've seen it in clients where they're like, okay, well, I mean, actually I worked with an athlete the other night who was not eating any pasta, bread, or rice because she thought she would gain weight because it was fattening. We had this long discussion and several sessions about it. And she texted me and she said she sat down and ate a pasta meal and loved it. So that's, I think, a good example of she was learning that she can still be a good athlete, a good person, and all those kinds of things, you know, at the weight she's at. So I do think it's a mindset shift that can ultimately help the disordered eating.
Sure.
Okay.
Permission.
Well, exactly. You said it right there. It's the permission, which is the principle number one in intuitive eating, is giving yourself permission to eat whatever you want. And I know what everybody says when they hear that. Well, then I would go binge all day long. Actually, you would not. You know, once you learn all the principles of intuitive eating. So anyway, but exactly, it's the permission. It's learning to be flexible. It's learning to handle emotions better. And also taking a look at that fear of fat and what is that really all about, or fear of loss
Right.
of control. What is that about?
Right.
So, yeah.
We are just about at our time. I was wondering if anybody else has any questions. Well, brief Q&A, or thoughts or statements that they would like to add. Got nothing. Oh, hold on. There we go. Yes, go for it.
Oh, has my microphone been on this whole time?
I think
No.
it has been. Yes.
I'm so
I will
sorry.
be emailed.
It's okay. I don't think we heard anything.
Yeah, this is a
No,
great talk.
I saw your mic go off a couple times, and I was like, "Oh, they're being so quiet. That's impressive."
Oh, okay. Yeah,
If
no, I was
you,
listening.
it is $10 for CEUs. So if you email me, here, I'll give you my email address in the chat. If you've paid already, then yes, I will be sending you. You paid already, then yes, you will be getting the CEUs. If you have not paid, sorry, I have an absurdly long email. mcasero@prisonsintegratedhealth.com. That's my email address, so you can email me and I can get you set up with the payment for the CEU. What the sheet, the paper, you know, that thing, that's the PDF that I will send out. Any questions, any follow-up questions for Cindy?
I did actually have a question.
Yeah, I think she.
Yeah, go for it.
Yeah.
Okay. So our teen is sometimes reluctant to come to meals, and we don't want to force it. So we've been like talking to her about it, but I was just kind of thinking as you were talking about strategies to like make eating pleasurable, there's just kind of a little bit of a push and pull right now of like, come eat with us, it's gonna be fun. And she's like, no, I don't want to. And then you know, just kind of trying, when she's there, try to make it fun, but like, I don't know. I just don't know how to, I don't want to like force her to come to the table, of course, but I did talk to her about why. And she said that sometimes it's because she just really doesn't want to talk about what we're talking about. And also because I don't allow phones at the table. So I don't know. We're just kind of in a funky spot. And I wondered if you had any tips.
How old is she?
15. I almost said 16, but 15.
That's a tough age, no matter what.
Yes.
Yeah.
I mean, that, and you know, Max, you're a parent as well. So
Yeah.
I personally think you should hold fast on no phones at the table.
Yeah.
I do think that's a boundary you need to keep. I guess one thing, just one little thing is, I don't think I would say it's going to be fun, because it's not always really fun. But you want to make it relaxing, maybe more low key. And I especially think for teenagers, it's probably better, you know, for little kids, you might want to think of fun.
Okay.
But for teenagers, they're wanting to be like chill.
Sure.
So maybe, you know, boy, it's tough, because I remember when my kids were 15 and we had some similar issues, because I think what I would do is, first of all, I would require that they come to the table, you know, that's just part of, that's the deal, you know, but they don't have to talk. They don't have to talk. They don't have to. And you can just carry on a conversation. And if I would probably not be asking them a lot of questions like, you know, how's school going? How's this going? How's that? Just, you know, think of something that's going on and maybe try to have a conversation. And you know what? She may come to the table, never say a word, and then just leave. But I personally think, and this goes back to Ellen Satter's Feeding with Love and Good Sense, that the expectation is that she does come to the table. Whether she eats or not is up to her.
Okay.
But she has to come to the table with no phone and just be consistent and just keep doing that. If she doesn't eat, she doesn't eat. Okay.
You know, I think it's interesting, Cindy, because what you're really talking about is like super developmentally appropriate.
Mm-hmm.
So this is gonna sound funky, but stay with me here.
Sure.
The developmental spaces that teens are in is very similar to where toddlers are in.
Yes,
So
it
if you
is.
think
Yes.
about like what's happening in brain development for a 4-year-old,
Yes.
that's what your teenager is in a similar space.
Very similar.
You know, and so it requires a lot of flexible structure. And where, like Cindy was saying, you know, with a 4-year-old, you want to make it fun. With a teenager, you don't necessarily have to do that, but what it's about is providing consistent time for connection,
Consistent. Yes. And
right?
you could, yes. I couldn't agree more. I'll be honest, as a parent, I do err on the firmer side in terms of, so I told my kid they have to come to the table. But like I just said, I tried not to, at least, like, you know, ask them all these questions because they don't want to be on the spot, right? They don't want to feel like that. So we would just try to make it pleasant, you know, focus on making it pleasant and relaxing, not fun. And, you know, maybe just have some conversations about things that are just totally unrelated to, family, you know, you know, and then, but, and don't make it last super long. You know, you sit down and you eat and you have a pleasant time. If they don't eat and they don't talk, that's their choice, but you're going to eat and talk and you're going to enjoy your meal, and then let them go. But just keep doing that. I think it's a phase that they're in.
Right.
They don't want to be around you. You know, they just, that's going to happen no matter what. Right. And it's hard. I remember with my daughter, it's like, oh, she doesn't love me, but they do. And what I noticed is they come back around, you know, they will come back, and it's a beautiful thing. I mean, it really is, when they finally come to the table and they want to be at the table and they're actually talking to, and you're like, I'm so glad I did that. I'm so glad I stuck to that. But because I think if you start giving in, I don't know. And other parents may totally disagree with me, but that's how I approached it.
Yeah.
Is food part of your like family culture? Like, I know that I love when my kids help me. It's a mess, right? So I've got a 4-year-old and a 2-year-old, but I try to, like, food is very, it's part of how we are culturally, just enjoying it. And so, like, is that a thing that you could engage your kiddo in? Is like, hey, come help me make dinner, or like one night a week you get to make the menu, or, you know, like something
great idea
that helps engage her in that process.
Oh, that's such a great idea.
Want to show up.
I think not a chance for helping with cooking.
Sure. Okay.
She used to help with baking some. And then I think if she had more of a choice of what we were eating, that might be helpful.
Exactly right. I kind of forgotten about that too. You could, you know, definitely involve her in what, you know, asking her what she wants for dinner.
Right.
Not that she gets her way every time, you know, but you definitely involve her and try to maybe have what she wants from time to time. You could also say, have her, you know, maybe instead of helping you with dinner, because that means she has to be with you, and that's what she doesn't want, right? Or she doesn't want to admit it. She doesn't want to admit it. She probably does, but doesn't want to admit it. But is, you know, hey, I don't know. I'm just thinking of this off the cuff, but like, you know, do you want to make the French fries in the air fryer, if you have an air fryer or something like that? And I'll do this over here. I know you could give it a try, and or ask her if she'll make dessert, make some cookies. Okay. And make sure you have all the stuff there, but then maybe not be around too much.
Okay. Gotcha.
Yeah. I just 14 and 15 for girls is hard.
Hard age.
Yeah. I'm feeling more like I'm home base right now, which is okay. But I just am trying to finesse it because I'm a very like connection oriented person. And it's probably overwhelming to her. Yes. Yeah.
You do have to kind of back off a little bit. And then I bet you $1 in another year or two, she'll be your best friend.
Okay. Well, thank you so much. I appreciate it.
Yeah. And thank you for joining us. Cindy, thank you.
You bet. This was great.